Hello and welcome to another blog summary video. It is cold in here, so I apologize that I am wearing a fleece looking all cozy, but couldn't help myself. Today's topic, we are going to get super nerdy and can't help myself with that either, so might have drop off with some of you, but I'm going to do my best to explain the exciting science and then also layman's terms. Today we're going to be talking about a concept called heart rate variability, or HRV. And why it matters in cancer recovery. This has really been gaining some traction, although it's been around for over a decade, I would say. We're starting to see a lot more adoption of it and stronger science, which is really exciting. So we're starting to really learn how HRV, or heart rate variability, can increase exercise tolerance, can also lead to insights on decreasing cancer-related fatigue and also reduce cardiovascular risk. So by learning about HRV over time, we can actually help people to exercise more effectively, reduce fatigue, decrease cardiovascular risk, amongst a lot of other beneficial health outcomes. So it's this new cutting edge kind of biomarker in exercise and recovery that's really starting to gain traction, and it's very exciting. And so to kind of get a little bit nerdy here, I want to explain what HRV is. And here at the Cancer Physio, we're always trying to stay grounded in science, so we know we're evolving too as the science evolves. So HRV, people have a resting heart rate, and let's say that is like 55 beats per minute. It actually isn't a metronome of duh, duh, duh. There's actually a variation between each beat. That's what HRV is. So using metrics and kind of complex mathematical analysis, they are basically determining the variation between your heartbeats and from that pulling data. And a lot of research has really started to confirm that this metric of HRV is very important and very insightful. So basically this HRV metric kind of tells us the yin-yang of our nervous system, that the nervous system kind of bounces between that fight or flight or rest and digest, or that go, 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 or that slow. And there's a toggle switch, and our system is constantly toggling between those states. And HRV indicates and tells us a lot about this. So what does HRV mean? Well, HRV in and of itself actually represents almost like a stress resiliency or an ability to self-regulate, and a balance in the nervous system, that it's able to handle these stressors and come down, and also kind of speed up when it needs to motivate and then come back down. So it really represents, that kind of resiliency of your nervous system. A higher HRV actually means that you have really good resiliency, you have good response to stress, you have good ability to kind of balance your nervous system. A low HRV actually means that you are less resilient to stressors. You are spending too much time in a heightened state of stress, or you're not toggling well or balancing your nervous system well. So what's really exciting, if that was confusing it over your head, here is an infographic with a nice pretty little home and heart to help it sink into your mind. But exercise can improve HRV, which is really exciting. So you have power over this metric that affects so many things. So 2024 meta-analysis, obviously then, of many studies showed that exercise training can impact HRV over time. What we saw was that the most kind of effective punch for impact was HIIT training, which is high intensity interval training. So we saw the most robust results with that. And this is where I found this really interesting, because there's a lot of kind of research trending now in the world of HIIT and cancer, which is really neat, but often patients come into my clinic very concerned because it just feels overwhelming to even think about exercising at higher intensities. So I just want to break this down a little bit. So what is HRV, HIIT training, and cancer? Like, how can we kind of break that down? As you know, at the Cancer Physio, we've kind of talked about different phases. In the second phase, which I call the treatment phase, this is where patients are often undergoing chemotherapy, radiation, or surgery. There is a lot of withdrawals. There's a lot of kind of challenge to the nervous system. So we do tend to see more cancer-related fatigue, and some of these treatments, like chemotherapies, can have a cardiotoxic impact. Couple that with radiation and so on. because of these kind of challenging treatments, sometimes HRV is actually impacted in a negative way and your exercise tolerance can go down. So, I always say with patients, the mantra is kind of day by day when you're in the treatment phase. Don't set big goals, don't expect big results, just work within that energy envelope and take it day by day. But what I do see with my patients is that when they come out of that treatment phase and into the next phase, which we call the recovery phase, and onwards into return to work and sport, we can see really exciting results in terms of HRV improvement. You'll often hear the analogy, if you've come into my clinic, that I talk about, kind of moving into the recovery phase. I use the analogy of a bank account. There are many withdrawals in the treatment phase: chemotherapy, surgery, radiation, hormone therapy. These are withdrawals. So that that account balance is starting to kind of go down. Once we enter the recovery phase, we are far from our good balance, our baseline balance, but we can start to see that balance go up. And slow graded exercise can help and deposit good big checks and increase that balance over time. But the exercise usually needs to develop in a way that we're redeveloping the tolerance, we're redeveloping the recovery. And so HIIT training right off the bat can be really challenging. I define what HIIT training is here in my blog. You can learn a little bit more about that, but it's specific small intervals of working very hard at least a 7 to kind of 8 out of 10 intensity. So sometimes that's just not manageable for patients to start. But we do see a lot of bang for our buck with HIIT training and HRV improvement. So it is the goal if we can get there. But as you know, some patients, even just starting to exercise at moderate intensities or higher intensities, we see a lot of push crash. And a lot of patients come into my clinic and they're just push crash kind of cycling. And they feel like because they're working so hard that they should be getting results. But actually push crash cycling is very costly. It's very expensive. Use the analogy of someone who's training for the Olympics, and if they train so hard one day that they then can't exercise for 2 weeks after because they're so sore or they've done so much damage, the overall volume of training goes down and they're farther from their goal. So what we want is consistency, and we want to go low and slow, and over time we can then increase to higher intensities. But we really want to avoid the push crash. So all of this just kind of shows you that even if we know HRV is a powerful metric, we know HIIT training can help improve it, rehab still needs to be personalized. And this is where it is important to have that cancer physiotherapy support and kind of personalized approach. So we know that HRV tracking can provide insight into chronic fatigue syndrome and kind of nervous system imbalance, where some patients are just not tolerating exertion or exercise. And we can use this metric to kind of help personalize the program. We also know that this metric of HRV can actually also provide kind of real-time data, kind of feedback on the spot. This is a young science. I don't have the technology for this, but this is how exciting this metric is. You could see and imagine that like really high-level athletic coaches and maybe even Olympians are using this kind of data to give them direct feedback as to whether or not they should push harder or take it back. And it gives that kind of really personalized approach to their performance and their exercise training. So, that's kind of exciting stuff. But as far as it goes with cancer, we just really want to start to use this metric a little bit to help avoid cancer-related fatigue, help avoid push crash cycling, and kind of start to get the right exercise intensity and prescription out there for patients. What's really interesting is that you do tend to see that with HRV, it does actually worsen when you do really hard intensity exercise or even cold plunging, something very stressful for the body. You can see that HRV immediately kind of react and worsen because we're in an aroused state. And then over time, HRV improves in the long run. So that's why it's so important to look at the big picture data here. Zooming out a little bit, HRV also does impact, in the world of disease prevention with cardiovascular risk. We see that if you do have a lower HRV, which isn't a good thing, then you might see an increased risk of myocardial infarction and other cardiovascular diseases. We also see that it can be related to cognitive function, and then frailty follows kind of functional health. So this just shows you that big picture of how much exercise is medicine, and HRV is such a metric of whether we're achieving that in the right direction or not. So how do you measure HRV? Well, wearables is the big kind of trend right now that's accessible, that most people have: Apple Watches, Fitbits, Garmin devices, and so on. But it's super important to understand that these devices have a lot of variations in their reliability. The science is really young. The technology is quite young. There is really kind of gold standard technology out there, but your average person doesn't have these kind of options or isn't investing in them. So you can use your wearables as a marker for change, not necessarily using the data for its specificity and its reliability, but seeing the trends change over time. Still very useful and a powerful thing. So if you're interested in HRV and kind of how to improve this metric, you can integrate this into your training, and we talk a lot about this here at the Cancer Physio. And like I said, first and foremost, we want to use HRV trends, not single values, day to day to guide on exercise intensity. That's not the kind of technology that a wearable offers. You could consider HIIT training. It's a lot of bang for your buck. But this is if you have good baseline fitness, you've come out of that treatment phase, and you aren't experiencing push crash. I have worked with Olympic athletes and really high athletic ability, such that in the middle of treatment they are doing higher intensity exercise without push crashing. That shows me that their body can manage that and they're getting the benefits of it. But if you're experiencing push crash, it is important, I would say, to hold off for a bit until probably the recovery phase to try some HIIT training. Cold plunging is a great alternative. If you're unable to do HIIT training, cold plunging actually stresses your HRV in the right direction, once again, as long as you're not experiencing that push crash cycling. You can expect short-term HRV dips with intense workouts and cold plunging, but what we want to see is that we recover, that there isn't a push crash, and that the adaptations of HRV move in the right direction over time. But in summary, HRV data should complement, not replace other health assessments. So that's where here at the Cancer Physio, we also want to look at, very simple things like blood pressure response to exercise, recovery rate, a breathing rate, and these other variables that are just all part of an exercise plan being personalized to you. So with any young science, of course, there's limitations, and there needs to be future directions. So there's definitely limitations with these wearables and the way that we're interpreting that data. And so we need more large-scale randomized trials at this point to confirm precisely how HRV-guided training in real time, but also over the long run, can improve outcomes. So there's definitely just more research that needs to be done. But it is safe to start, and it is safe to assume that trends can be interpreted with some reliability through these wearables. So really exciting stuff. Science is always exciting, and I'm excited to start using this more in clinic with you. We've done some recovery rate tests and strength tests and breathing rate tests, but this is just another metric we can utilize over time to track your progress. So once again, thank you for your interest in science and rehab.